I'm Tim Malloy with the Palm Beach Civic Association. It is Monday, April the 1st, and we are no doubt about it headed into the hardest period yet on this, next couple of weeks for sure. A time when we all need a lot of comfort and love, and we need advice as well. And a very well-known Palm Beach Civic Association director has some for us right now, so take a look.
To my friends at the Palm Beach Civic Association, I know how difficult it is to stay sheltered in place. It's seemingly easy, but it's tough to sit down and do nothing. Most of you are go-getters and are normally active and going out and changing the world. But let me walk you through some of the realities of this COVID-19 pandemic. The only real chance we have of knocking it back and suffocating it is through social separation, social distancing. And as crazy as it might sound with all these technologies we have, and there are probably 100 different ideas for treating patients who have COVID-19, and some of them are going to pan out, but it'll take some time. And we've got vaccines that are rapidly coming down the pike list. And I've looked at all this information. I'm very optimistic. But for the next year, we've got to keep the virus at bay to buy us time to fix a lot of these systems. The best way to do that has been demonstrated to be social distancing together with testing. Now, we're just now getting up to speed on testing. The president has said, and I asked a question about this on a recent town hall, that we're going to be able to have testing out to most of the country within the next week to 10 days. That stated, we still don't have enough information to target folks who are ill and ensure all their contacts are able to be quarantined so the virus doesn't spread. Once we're able to do that, that's called containment, then a lot of the pressure comes off of our need to stay away from each other. But in the meantime, our best chance, our biggest opportunity is to stay apart from each other. It's primarily done through staying in your homes. Now, in New York City, where I know many of you have some connections, we did not do that in a timely fashion. One of the reasons that there's chaos here and it looks like a battlefield is because we've got so many folks who got ill 2-3 weeks ago, didn't realize it was happening, and now we're all paying the price with ERs that are overwhelmed and patients being put on breathing tubes outside of the ICU. We'll get ahead of it. It's going to be difficult. 2 more weeks of pain here in New York. But for the rest of the country, we want to avoid this error. And the best way to do that is to oblige your elected officials who are well informed on these issues and stay away from each other. As challenging as it might be, it's an opportunity for you to improve yourselves. Read that book you've always wanted to get into, or learn a hobby that you should have done years ago. Figure out ways of identifying what the opportunities are in this new world that's going to arise in May and June as we start to come out of this lockdown scenario. I know many of you played Etch-a-Sketch when you were kids. I certainly did. The Etch-a-Sketch of life that we all drew for ourselves has been shaken up. And so you got to figure out how you're going to redraw what you need to have on your Etch-a-Sketch. Be part of the leadership that's called for right now. You know, effectively, these are battlefield commissions being thrown out to people who are leaders. They didn't realize it. They didn't want it. Maybe they've actually done it in the past, but this is a new opportunity to lead us into the future. So take advantage of that. Show what the best of Palm Beach can do and stay away from each other.
Good advice from Dr. Oz. Now we move to the Fire Rescue Chief, Daryl Donato. Wendy Rutledge talked to him about today about preparation in the hospitals locally in Palm Beach. Palm Beach County, third in the state with number of cases. So he is concerned, legitimately concerned, that there could be a real overload of patients into our hospitals. So it's tough to listen to, but here's Wendy with an overview on that.
Tim, Fire Rescue Chief Daryl Donato took time out from his extremely busy schedule to answer a couple of very concerning questions about whether or not we will experience a surge in our area, as well as the hospital preparedness locally, especially with regard to ventilators. Here's Chief Donato.
Chief Donato, thanks for being with us today. First question, what is actually meant by the term surge? And do you anticipate that we are going to experience a surge in our area? If so, when might that be?
So when you hear the term surge or hospital surge, we hear a lot of it talked about hospital surge. This is that ability for a hospital to absorb more than their normal capacity. And the model that we're looking at the most is a model out of the Institute for Health Metrics and Evaluations, which is done by the University of Washington School of Medicine. And this model out of the University of Washington is predicting that in Florida, statewide, not necessarily in Palm Beach County, that by April 15th, we'll begin to exceed the bed capacity of our hospital system. And that will continue into the middle of May.
can you give us your assessment of the preparedness of our local hospitals, particularly with regard to do we have enough ventilators?
I can tell you today that there's about 135 adult ICU beds available in Palm Beach County. That's a good number. That number is actually up from earlier. So they're managing bed capacity very well. The hospitals in this area, and we've been in touch with the ones that we use frequently, and they're all working really hard to ensure that they have staffing and beds and ventilators and those things that they're going to need for what's anticipated, that anticipated surge. And I think they're doing a great job. And I can tell you also, Palm Beach County Division of Emergency Management is working hard to help get them PPE and supplies that their staff needs. Some of that will be arriving today and sent out to those hospitals to make sure that they're all supplied as they should. And also ventilators. I know that Palm Beach County's ordered a lot of ventilators from the State Department of Emergency Management. And I believe those ventilators are actually, 20 plus ventilators are on their way here now from the state to supplement what we need here in Palm Beach County. And beyond that, the county has been very innovative in reaching out to all the ambulatory surgical centers that exist all over this county. Those ambulatory surgical centers are no longer doing this elective surgery work, but they all have anesthesia machines that can be used as ventilators. They all have beds. They all have staffing. And so the county is trying to work with all those ambulatory surgical centers to serve as hospital bed space and ventilators should that surge hit here.
Finally, do you have a message that you'd like to get out to town residents, town workers, with regard to what we can do to help you and your staff, your crew, do their job?
The single greatest thing that each of us can do as individuals to protect ourselves, to protect our family members, to protect the people that we know and love, to protect your neighbors is to stay home. It is safer at home. If you stay home, you are not part of the spread. The more you leave your home, the more likely it is that you will be part of spreading this to somebody who will then spread it to somebody else, who will then spread it to somebody else. And that's not just generally once. If you spread it generally to two people, each of those two people spread it to two people. And so it just multiplies. And so, again, the best thing that each of us can do as responsible citizens, as friends of others, is to stay home because it is safer at home.
Chief, thanks so much for your time today. We really appreciate it.
Well, thank you. Thank you to the Civic Association for all you're doing to get the message out into this community and then all you have done now and in the past to help the people in the town of Palm Beach just stay safe and to help this incredible community get through this difficult time, because I know we're going to come out of it stronger on the other side.
Now the beaches. We have a shelter-in-place order right now in our town. What that means is it's like a hurricane's offshore. You shouldn't leave your house unless you absolutely have to. If you have to take a short walk, yes. If you have to get food or see a doctor, of course, or a vet. But that's it. It's finally sunk into the people who abused this and went to the beach. And there was a lot of young people out on the beach last weekend. There certainly won't be this weekend, because if they are, they'll get arrested. I took an overview of what is now the case, which is beach closure and what that means, who can go on them and who cannot. The tire tracks from all-terrain vehicles, police all-terrain vehicles, tell the story. They've been patrolling the beach. There have actually been citations, arrests made for people who are violating what is now a demand from the town of Palm Beach as far as keeping people off the beach during this crisis. And over the weekend, there was a big party out here as a lot of spring breakers ignored the warnings and the advisories and actually partied on the beach, wave runners up on the beach. It was troubling to a lot of people. So as you can see, there's nobody on the beach this morning. It's something you've never seen before in this part of the season. But it begs the question, who owns the beach? And can the town actually do this? If you own private property on the beach, is your beach your beach? Can you actually go in the ocean? Can anybody go in the ocean? So we were trying to figure that one out today. What seems the healthiest of activities outdoors has now been forbidden, and it doesn't take an epidemiologist to explain why. The virus is airborne. Large clusters of people in breezy places offers the virus an opportunity to hopscotch from one beachgoer to another. So the rules are unequivocal and will last indefinitely. Here are the rules. Owners of homes on the ocean can use the beach in front of their homes, but not below the high tide line. Essentially, they have to stick to their property or a few yards east of it. No one other than owners can be on the beach under any circumstances, and no one can go into the ocean. That, coupled with a ban on swimming in condo pools, has led to a great deal of debate. The deadline to complete the U.S. Census has now been extended to August the 14th. You can do it online in your spare time. It's important. Taking part in the census is critical to Palm Beach receiving federal funding. We're going to close with Maggie Zeidman, who has been giving us valuable medical as well as governmental advice, in her dual roles as a nurse as well as a town councilor. Today, this is something maybe a little bit for the soul, on the spiritual level, no matter where you come from on that. There's a very nice event globally, and certainly in our town, that's going to take place tonight, if you want to take place. Maggie can tell you about that.
I want to thank everyone for your attention to social distancing, for taking all the CDC recommendations and everything that the town manager and his great team and the council and the mayor have suggested to you. You've taken it seriously, and therefore we may actually be flattening the curve. We can't predict that at this point, but let's hope so. So I first want to say thank you to all of you. The other thing that I want to say is we know we're in uncertain times, in uncharted waters, and I want to make a special, just to say something to you all about the medical people, the doctors, the nurses, the first responders, the respiratory therapists, the nursing assistants, all of the people who every day put on those scrubs and walk through the hospital doors and have the courage to go and take care of patients who are very sick with COVID-19, even though they themselves may acquire it. They do it despite all of the things that could happen to them. They go up to the floor, they go into the patient's rooms after they've suited up properly. They hold hands, they put a phone up, a personal phone up to a patient's face so that they can see a daughter or a son. And I think that today we really have to thank them. So one of the things that's been going around, or going viral, if you will, is to do something that we can do from our homes to show support for their courage and the gift of compassion that they give to us so willingly. And so tonight we're asking everyone to light a candle, either put it in a window, that's why I have my candle here, put it in a window or put it outside. If you go out for a walk, please take a photo of the lit candles so that we can show our doctors and nurses and first responders and all the other medical personnel how much they mean to us. Let's let them know that what they do, that their courage, their bravery, their compassion, their empathy, their calling, that it means something to us. They mean the world to us. We have several doctors, parents of doctors, and doctors here. We have Dr. Dotson, who frequently speaks to us on issues of infectious disease. We have Dr. Oz, whom you've heard from today, who's also a director of the Civic Association. We have children who are doctors. I have two. Dr. Zeidman, our daughter, Jessica, and Dr. Zipperstein, our son-in-law, both internal medicine doctors at MGH. This is my MGH scarf, given to me by Jess and Josh. Michael Pasillo, one of the executive directors of the Civic Association, and his wife, Debbie, have three doctors, Dr. Pasillo and Dr. Pasillo, and Dr. Gunaguntla, working in the New York City hospitals. So it touches all of us. It touches us in a very real way. So let's light those candles tonight. And please, if you do go out for a walk and please take a picture of it. Maybe send it into the Shiny Sheet, maybe send it to the Civic Association. Let's let them know how much they mean to us. I'll see you again on Friday, and we'll talk about some more of the symptoms and medical issues. So, signing off for now, be well, stay home, follow all the CDC recommendations, don't get sick. Thank you.